Speaking of doctor.
Continuing our health theme, we were made aware that it is Colorectal Awareness Month.
Cancer Awareness Month.
And we've got a guest who's here to talk about that, Dr. Thomas Magrino, a colorectal surgeon with Woodland Healthcare. And doctor, we'd like to thank you so much for joining us.
Well, thanks for having me.
So when we talk about colorectal care, we always think of colonoscopies.
Yes, sir.
Can you explain to people what a colonoscopy is?
A colonoscopy is a test where we get to actually look at the inside of the colon. The patient cleans themselves out the day before, and they come into our surgery center or an office. They're given intravenous sedation so that they're sleepy. I would say about 80 to 90% of the patients don't remember anything that happened that day because of the medicine we give. And then we take a long flexible instrument with a digital camera on the tip and insert it in the bottom and go around and see the whole colon. If we see anything exciting, we can either remove it or biopsy it. If it's a polyp, we can remove it and study it under the microscope and see what kind of polyp it is and if it's a problem.
And it's not that uncommon to find polyps in there, and you just snip them as you're in there, right?
About 30% of colonoscopies result in the finding of a polyp.
Okay.
And awareness of colorectal cancer is so important. I was actually surprised by the statistic. It is the second leading cause of cancer in the U.S.
Second leading cause of cancer death in the United States, and the third most common cancer.
I think most people probably don't know that, aren't aware of that.
1 in 20 people in the United States will suffer from colorectal cancer.
We're getting a lot of people wanting to have questions answered. Jeff, what are they asking?
Yeah, doctor, you may be able to help some of these viewers with their questions. Donia Rodriguez says, what are the early warning signs of colon cancer? My best friend's mother died from colon cancer very shortly after being diagnosed. And on that same note, Kelly Ramirez says, my grandmother passed away from colon cancer within 6 months of being diagnosed. So same story. She says, what are the early signs?
There may be no early signs, and that's why screening colonoscopy is very important. And everyone should be screened starting at age 50, and if there's no risk factors for an increased risk for cancer, then they should be screened about every 10 years. The most important thing that I see, or the most tragic thing that I see, is a patient who has bleeding from their bottom or blood on the toilet paper, and they say, well, it's my hemorrhoids. I've had at least 3 patients in the last year come in with a year-long history of hemorrhoids. I do an examination, and I get to tell them the bad news that there's rectal cancer.
So, doctor, if you see that just once, blood when you're using the restroom just once, or is this something that if you see a couple of times, alert your doctor?
Well, I think that most people can tell if it's a little irritation on the outside and a little blood on the toilet paper. But if you're having several episodes of bleeding, and certainly if you're age 40 or older, it's worthwhile to go see a doctor about that. And don't let the doctor just pat you on the back and tell you it's hemorrhoids. Have someone take a look. And in my practice, for various reasons, anyone over the age of 40 with blood from the bottom gets a colonoscopy. I had my secretary several years ago, 40 years old, died of a colon cancer.
And is colon cancer like so many? If you catch it early, you got a chance. If you don't catch it early, it's going to be really tough?
If you catch it early, it's very easy to treat. Surgery is the primary treatment and often the only treatment necessary. If we can get it in the early stages, we cure 90% of patients.
How do we lower our risk? Are there risk factors out there?
Fiber?
High fiber diet, 30 grams of fiber a day. I tell my patients not to try and manipulate their diet. No one's able to do that. I tell them to take a fiber supplement like it was medicine. There's several commercial kinds of fiber supplement. I try and encourage people not to take the fiber supplements that have additional laxatives in them, because I don't want them to have it as a laxative. I want them to have it as a fiber supplement.
Does the fiber cleans out? Is that the
fiber? The fiber decreases the amount of dwell time of substance in the colon, so that whatever environmental factors may induce changes in the colon surface that could cause cancer or could develop into cancer, those environmental things are just moved through faster, so there's a less chance for those things to cause problems.
So to wrap it up, if you see any signs, you need to go into the doctor. If you're over 50, you probably should get a colonoscopy. And then after 50, if they find a lot of polyps, they call you back quickly, a couple years later?
3 or more polyps, I'll see someone in 3 years. Less than 3 polyps, I'll see them in 5 years.
It isn't painful. The hardest part is preparing for it.
The prep is the part.
It's brutal. It's brutal. You drink this stuff and it's not good. Dr. Magrino, thank you so much. We appreciate what you're doing, getting the word out.
All right. Thank you very much.
All right. Thank you. We're going to send it over to Sharon now, who's keeping track of our headlines.
Well, Safeway says that
Oh, actually, Sharon, I'm sorry. We're going to send it over to Jeff. Jeff? I'm not mean to ignore you. I'm sorry.
Oh, okay.
Your turn.
Yeah, well, I was just kind of looking over some of the questions here for the doctor. Someone else just asked, are colon cleansers good for your colon? That was a question that just came in.
No.
Oh.
They're not.
I've never seen any scientific evidence to cause that, to show that that's worthwhile. Some of the colon cleanse products actually have stimulant laxatives that can cause changes in the actual surface of the colon. People don't realize that many of the natural laxatives are actually colonic toxins. The teas that people can buy are actually stimulant laxatives. They're toxins to the colon. If you need a laxative, use a fiber. If you need more help, use what we call saline laxative, milk of magnesia.
I'd say that was a
generally
definitive
recommend.
answer.
That's a great answer, Doctor. Thank you so much for giving that advice. We're also following some other things.